Okay, so I see that you've done some research on the internet about iontophoresis, which is the treatment that I want to use on your Achilles tendonitis. I just want to clear up a couple things before we continue so that we both feel a little bit more comfortable about what's going to be going on. And so that I can give you my advice and feedback on using this treatment for you and how I think it might be beneficial. The first thing when looking on the internet, we want to make sure that we are looking at credible and reliable sources. A lot of websites out there are not so valid and don't speak a whole lot of truth about things, especially medical things. So we want to make sure that we're looking on credible sources and websites and articles that give us a lot of good, reliable information that we can count on. With saying that, I've seen YouTube videos on how to create your own iontophoresis at home. So just things like that we want to stay away from, just because, I wouldn't mess with doing things. It needs to be done the correct way in the clinic. So a prescription needs to be written from your doctor for the medication that we're going to use for the iontophoresis, which is called dexamethasone, and it is an anti-inflammatory, and it is going to help decrease the inflammation and the pain that you're having in your Achilles tendon. So with that, the process of the iontophoresis application is we have two pads, and one of them is where the dexamethasone is going to be injected into the pad. So you are correct in the sense that physical therapists cannot administer injections. So the injection part is injecting the medicine into a medicine pad, and that pad is going to be put onto your Achilles tendon. Okay, and then so the other pad is the electrical stimulation pad. So the iontophoresis, it uses electrical currents to help penetrate that medication into your Achilles tendon deeper into the tissue than as if we were to put some type of cream or like a for an example, like a Bengay, where it just is very topical and it doesn't get deep into the tissues, as opposed to iontophoresis, which gets deeper into the tissues to help the inflammation and calm that down and to help decrease your pain. A lot of evidence actually is not out there with iontophoresis for your type of diagnosis of Achilles tendonitis. However, there isn't evidence trying to stray away from that. So there is the evidence that is out there is saying that it is beneficial to try and to use it with an inflammatory condition that you have, because it is beneficial and it does have very great effects. And also to use it in combination with physical therapy as far as exercises, strengthening, and stretching. So to use it in combination with things, not just iontophoresis by itself. So even though there's a lot of information out there of iontophoresis, we do want to make sure that the information is reliable, and the information that is reliable that is out there is not very much, but the information that is out there is saying that there are some benefits to using this intervention with the diagnosis that you have. So we're going to go ahead and try it out, and hopefully it does the work.